want to bring your slides up and I'll introduce you. Lisa's going to talk similarly about the COVID pandemic. So we've got Lisa Neill, Primary Care Manager for the NHS Ayrshire and Arran Dental Service, who's going to be talking about From Adversity Comes Opportunity, talking about COVID pandemic and the challenging times it's had for health services. So over to you, Lisa. Thank you so much. Apologies for the slight delay.
No, it's completely fine. So thank you very much for having me. I completely feel like I've got imposter syndrome, especially after the last couple of sessions. So, but I really wanted to, I've went against what I would normally do, and I'm quite shy and reserved, but I really wanted to share with as many people that can listen about all the extraordinary work that's happened, especially in Ayrshire and Arran, but I'm quite certain it's happened everywhere across every health board in the UK. So I'm going to talk about the public dental service and the primary care dental service specifically, and what we have done and what we did through the pandemic, and things that we will probably continue to do because of what we've learned. Here we go. So Gordon MacBeth was meant to be joining me, but unfortunately he's not been able to come along today. So as I said, my name is Lisa Neill and I'm a primary care manager for the public dental service in Ayrshire and Arran. And when the COVID-19 pandemic came to our shores, I'd only actually been in post for 3 months. So it was a completely, to say it was challenging is the least that we could probably say. So, and I'm just going to move on to the next slide. So just in case anyone doesn't know, there's sort of several strands to dentistry, and the ones that I'm going to chat about today is really the primary care aspect. So that is the public dental service and the general dental practitioners. So you may recall from your own experiences or hearing from your own dentist that way back in 2020, dental practices sort of had to close. Prior to that, we were getting rumblings. We were hearing from our director of dentistry that because dentistry has the majority of treatment is an AGP, so that's an aerosol generating procedure. So if you use a filling, you use any sort of ultrasonics to clean your teeth, that basically was high risk. So we basically dentistry ground to a halt almost straight away. But before it did ground to a halt, we were lucky enough to basically think that something was going to happen. So we pulled together an extreme team. So we had the director of dentistry, and we pulled together the dental practice advisor, who's a practicing general dental practitioner. And we had the area dental committee chair, who again was a practicing GDP within Ayrshire and Arran, and the specialists, and also myself and Gordon were heavily involved. So we were having regular conference calls in the morning. So if we got an update on the news, or we got an update from the Scottish Government, we were chatting through how that might be, anticipating what that might mean for dentistry. And I am a terrible worrier, so probably a couple of weeks before anything happened, we had pulled together sort of standard operating procedures, pathways. We had worked on paperwork for triage of our patients. We'd worked really closely with our infection control team to make sure that we had the right environment. We checked our air changes, so we were ahead of the curve. So when we did get notified that dental services were going to close, so your high street dentist could no longer open its doors, and what the Scottish Government advised, the Chief Dental Officer advised, was that urgent dental care centres were to open. So that meant that every single patient within Ayrshire and Arran that would normally have accessed primary dental care was actually going to come through our centres. So we had 4 urgent dental care centres in Ayrshire and Arran, and because our team were involved in that, so I've actually missed a part. So we basically pulled the SOPs prior to it going, everything closing. We actually met with our team, socially distanced. We cut them into smaller groups so we could meet with them safely, and we gave them an opportunity to discuss the plans. We gave them an opportunity to become familiar with the pathways. We were able to change things if they felt that it was not the best way to work. So our team at that point was ready to go. They felt comfortable with everything that COVID sort of involved. And because we're already in contact with a lot of our general dental practitioners, they were also heavily involved, and with the sort of Microsoft Teams coming into play, we actually began to meet with our team, our whole team, on a regular basis. So I've mentioned here we've got extreme teams and team meetings. I'm rattling on, I'm such a blather. So we knew that this was going, the COVID pandemic, we've got all the patients coming into our urgent dental care centres. We then were advised that the general dental practitioners could actually come and help us within the urgent dental care centres, and because of the really positive relationship that we have with them, they were actually bringing their nurses, and we were able to share our learning. So it was completely different cleaning. There was terminal cleans, we had to have fallow time, so if a patient left, you had to leave the room vacant for an hour and such like. So we were able to share our learning across all the general dental practitioners at the time. So we shared that care with them. We knew that our patients and the general dental practitioners' patients were anxious, and they weren't really aware of what was happening and why they couldn't get an appointment with their own dentist. So our director of dentistry began a suite of letters. So every time there was a change, he actually penned a letter to explain and what that meant for every individual. But he also explained what the dentists, their own dentists, were doing. So he explained that they were actually helping with the urgent dental care centres and what to expect if they contacted their clinic. We went out to explain about patient information videos. So we explained what the PPE looked like, especially for paediatric patients, and we obviously treat a lot of special care, so we interacted a lot with the carers as well. And we made sure that at every stage we sort of updated the patient information videos. Our director of dentistry also went on to complete update videos, which we shared on our social media, and the general dental practitioners shared that on their websites as well. So it was a sort of one for all. We were all aware of what was happening across the whole of Ayrshire and Arran. And then we went one step further. We were obviously with the movement that practices could reopen, so they were able to see some of their own patients in their own practices. We pulled together the GDPs across Ayrshire. So the director of dentistry met with them. It happened fairly frequently. It was every couple of weeks. And they talked through, so there was lots of peer support. They could talk through sort of concerns, and they felt that they were all included. They knew exactly what was happening at every point. So the practice champions is definitely something that's continued, as is the rest of it. We continue with our patient information videos as well, but the practice champions absolutely is something really positive that's come out of the pandemic. So we also realised that our patients needed to know more about dentistry, and we decided to embark on a dental app. So rather than us looking at the content of that, we went out to our colleagues across primary care within dentistry and asked what they would want in a dental app, would their patients like to see, because what we envisaged was a one-stop shop of dental information for the patients in Ayrshire and Arran. So we ended up having 6 tabs, and that shared information about orthodontics. It had a title specifically about COVID-19 and what to expect and all the updates that was happening. And that's evolving now, so that completely is another success story that's come out due to the pandemic. And off the back of that, we found that we could have a secure area on our dental app, which our colleagues in primary care could actually access if they registered it. So that's been an area in which we can share information videos in relation to referral criteria. We've been sharing trauma information, basically any learning that we can share. We've been adding that, so basically the access to that and is increased. We've seen a lot of our colleagues actually interacting in that. And I can actually see, yes, and to sort of add to more detail on that, we've filmed specific sort of tutorials and such like for our GDP colleagues as well. What else did we do? So the last wonderful session explained that people needed to feel connected. We knew that our team, normally they were all very peripatetic and worked across sites. Because of COVID pandemic, we tried to keep people in individual locations so that they weren't going across and possibly infecting each other. So they weren't able to have that sort of network and friendships across the site. So we had a closed Facebook page that we shared good news stories, obviously nothing related to patients. It was all very much a social network. So we could share birthdays that we would normally have. We shared retirements and pictures of success stories from their personal lives. We also had a closed Facebook page in partnership with our dental committee with the general dental practitioners, so that they also had a regular area that they could seek support from their peers, and they could ask us questions and we would be able to get back to them the next working day. So that's another area that's continued even now. And because of the practice champion meetings that we conduct regularly, we were able to see areas that our colleagues were uncertain of. So we've been running continued professional development events. Our most recent has been in domiciliary care, and they've been really well received. And the next point that is still ongoing, because of Teams, we were able to have more regular dental huddles. So every morning at 8:45, my whole team meets to discuss sort of issues, staffing concerns, any equipment, but it also looks at capacity. So we're able to share capacity a lot better, and everybody knows what's happening across the whole service. We were also concerned about, there's a wee bit that's come up there. We're also concerned about when we normally, prior to COVID, we had a regular input in schools. So we were able to have child smell visits. So that's about diet and advice and the application of fluoride. Because of the pandemic, we did not have any way into schools, and we were concerned that that was a whole population within Ayrshire and Arran that wasn't getting access to oral health care. So we were looking at ways of incorporating dental health into the curriculum to make sure that if something like this ever happens again, then we would have a suite of information that we could ensure that the children were getting regular input. So we did a video basically about the world of work and what each profession within dentistry, and we've also are inputting into sort of science and art coursework, so that oral health and dental health is spoken about on a regular basis. So we're really excited about that. So part of that would be the preparation of lesson plans, so that when a teacher comes in, they have to prepare for the year. And we learned that basically it's a huge amount, it's a huge task for every teacher to look at new material. So we thought we would jump on that and harness that, and we basically pulled together lesson plans in which they could pull off and use the next day. So that's a work in progress. We're looking at the moment of running a competition for secondary schools to develop a dental jingle, which we can use on our app and our social media. But part of that is we will release sort of oral health website, so that they have to do some research into the contents of that. So again, it's about incorporating dental into sort of the curriculum. A lot of what we have done has been replicated across Scotland. So there's fabulous work going across dentistry, and as I mentioned earlier, across the whole of healthcare. And we realised that if we had an area in which we could share resources and knowledge at the beginning of the pandemic, we could have saved a lot of time and a lot of heartache. And off the back of that, we've basically nationally, we've pulled together a public dental services national team. So we meet every 6 weeks, we share issues, we share resources, we share, and really it's been saving the NHS money, and it's also enabled peer support across health boards, and almost like a Once for Scotland across for dentistry as well. So it's been really, really positive. I've got to define it. I knew I would finish far too soon. So I suppose what I would like to sort of end on is all the work that is ongoing because of what has happened. You'll be pleased to know, certainly after the previous session, we are actually working on team working. So we are investing in our staff and looking at team days away. So that's actually going to be funded by an endowment scheme. We realised that the team ethos had broken down slightly because they weren't working in close partnership, and so we're looking at that this year. And we're also working on peer support. So we're nominating or several team members from each site will go to training in order to support each other. So they'll get mental health awareness training. And be able to escalate if someone was feeling, unwell and required further support. And as I mentioned before, the education lesson plans, that's absolutely something that we'll be building on as we go forward. And we're also looking at IT and how we can better harness shared regional resources. So I think I've flown through, and I'm afraid that's all I've got to say. So thank you very much. I absolutely still am suffering from imposter syndrome, especially after everybody, but I really did want to just showcase what our team has done. I'm exceptionally proud of everybody in Ayrshire and Arran, and yeah, so thank you very much.
Thank you so much, Lisa, and it's fabulous to see what you've achieved in such a short space of time and given so many pressures as well. Just reflecting on your work there with education, we definitely need to get health and social care onto the curriculum and have those professionals going into the schools and actually interacting with children, pupils, leading those sessions, particularly those that are in college that are deciding what they're going to do with their future, and those that are about to sit the GCSE. Mm-hmm. They need to be going in there and raising awareness to say, this is the career that you can have, this is the impact you can make. Does anybody have any questions for Lisa? We've got a couple of minutes before we're joined by Jack. Please feel free to unmute if you've got a question to ask. We have got a few attendees in this session. Speak now or forever hold your peace. Dee says that was an excellent session. Thank you so much.